And what I'm going to talk about is um, in the medication-assisted treatment field, how to build corporate and community partnerships that do these same things. You know, what they were talking about was, ACEs and trauma-informed care, but, you have to have good community partnerships in order to really get your patients the care that they need. And what I'll be talking about also will lead into the next segment, which Jason Pritchard and his team are doing some wonderful work with this as well. So I think it'll be a good transition into the next segment. So we'll just go ahead and get started. So next slide. Again, I want to thank Lisa and the One Tennessee staff, and of course, all of y'all for being here today. And my topic is going to be successful approaches in building corporate and community partners and why they matter. And I can sit here and talk about medication-assisted treatment, but you know what? All y'all know what that is. And for a lot of partners and community agencies, it's a taboo subject. It's not well received a lot of times. And so we have to go out into the community and explain and educate what MAT is. We have to show and be very transparent and be willing to coordinate services and be willing to be open and honest about everything that we do. So I want to share with you what we do and why and how that's been successful for us. Next. Okay, first of all, I want to share with you some of the things and the agencies that I've worked with. And those include social services, law enforcement and criminal justice systems, educational institutions, healthcare, labor and workforce development, faith-based organizations and leadership, civic organizations, and of course, media and press. And when you have good relationships with all of those, then you can really get a lot of things done. You can get your mission out and you can get your information out to just about everybody that you need to. And so my work with ReVIDA over the past 4 years has been to develop those partnerships all the way from Whitfield, Virginia, which is where we start, all the way to Knoxville, Tennessee, and to build those partnerships so that, number one, our patients get good service and good treatment when they leave our office. And in medication-assisted treatment, your patients are coming in there either weekly or biweekly or monthly, and they only see the MAT provider and the clinical team there, very little. I mean, it's once a week or twice a week or once a month. But when they leave our office, there's a whole world out there that they're exposed to, and we have to have partners for them to go out there and get their extra services. If we don't have those partnerships set up, then they're on their own the minute that they leave our office. And that's so very important. And that's why building these partnerships and great relationships and collaborations are super important. Next. So what are the most important things in building partner relationships? And I identified, I think, 5 that I wanted to share with you today. And the first one is being visible in the communities that you serve. And I don't know how many of you that are on here today work in treatment, and especially MAT treatment, but being visible everywhere is super, super important. Every Tom, Dick, and Harry thing that you can go to and say, look, here we are, ask us questions, be willing to be vulnerable and let someone ask you anything that they want to ask. Go to everything and put your information out there for the community to see. Years ago, a lot of treatment centers, they didn't want to go to many things because they were not welcomed. But I think showing up and being willing to say, here we are, we want to be partners with you is very important. Number 2, be a team player. And if possible, be the leader of the team. And one of the ways that we do that is we take part in almost everything. And one way that we became a leader over the past couple of years is in our Whitfield area. We established an opioid task force, and we allowed our office there to be used on a day that we didn't have services there. And we had a lunch meeting once a month, and we had every single organization that would come join forces with us and create an opioid task force. And that's a picture you can see there. We had everything from someone from the local hospital that was there, the health department, the police department, fire department, and all your social service agencies. Someone from every single thing was there just about. And so we worked together to see what was needed. Where were the gaps there in the with Bland counties? Where were the gaps, and how can we work together to address those? Well, guess what? We held it there in our office. So all of those agencies were coming into our office and seeing what we did. Of course, it was on a day we didn't have patients because we couldn't have them around patients, but they saw our office. They were there looking, wall to wall, eyeball to eyeball. Our other staff was there. And it was great because we were being visible. We were saying, hey, here we are. Ask us questions, and we want to be part of this community. Next. Be transparent. Encourage questions, like I just said, and answer questions without being on the defense. And a lot of times, people or agencies that are MAT are always on the defense because they've been used to being hounded and treated like the redheaded stepchildren for so long. And so we're trying to reduce stigma. And so instead, have a we mentality and invite the community to be part of we. Have a we mentality. We're all in this. We're just like with COVID. We're all in this together. Everybody is a part of. Substance use disorder, opioid use disorder. This is not a me or a you problem. It's a we problem. And the next thing is super important. Be accepting and complimentary of other forms of recovery models. Medication-assisted treatment is not the only way to recovery. And so we are very open and honest and say, this is not the only way, and MAT is not appropriate for every person. So we invite other forms of treatment models to come and partner with us, because if we have a patient that this treatment doesn't work for or is not appropriate for, we want to have a partner to refer them back out to that works for them, and vice versa. Next is invite to serve. Oh, I'm sorry, go back. I wasn't finished. Thank you. I'm so sorry. Lastly, invite to serve. If applicable, offer partners the opportunity to share services with your patients. And we have things like lobby table services. All of the social service agencies, like this one is UT Extension, but the health department will come, and domestic violence services will come, and housing will come, and GED services, and then higher education. They will all come and they'll do a table in our offices, and they'll set up their services. And while our patients are sitting there waiting for their name to be called for, to go back and see the counselor, the case manager, or the doctor, guess what? They can use their time wisely and build relationships with the people at the table. And the people at the table are those people out in the community that they need to be seeing when they leave our office. Many times we find that it's very hard for them to go to the health department. They feel judged because of the medication that they're on. But guess what? If they know the people at the health department, because they see them in our office, they feel like, hey, I'm not being judged any longer. They're willing to come here. They're willing to come into an office where I'm receiving treatment and talk to me. And that breaks down so many walls. And it's so very important to let them see that. So also, the one that I think is probably the most important lobby service is domestic violence shelters. That one is probably the most important, is to have as many of those come in as possible, because a woman or man, because domestic violence can be either or, that may be the only time that they're by themselves that they could actually hook up with someone, from a domestic violence shelter, because they're monitored by their abuser so closely, and their phones and everything. So that has been a really important service to have in our lobby set up. Okay, now I'm ready for the next one. Okay. Building partnerships also begins with education, and everywhere you go, whether you're hosting an event or whether you are attending an event, educating about what opioid use disorder is, and that it is, there's 3 stages to get there: tolerance, then dependence, then the actual active addiction. And I won't read all of that because I'm sure all of y'all know that, but making sure that who you're working with does know that, you just don't become addicted. There's stages. There's stages of that. Okay, next. And also building communities continues by reducing stigma. And reducing stigma is reduced greatly in our communities by the words that we use. And when they send this out, or I guess they'll send it out, this document here is it's called Words Matter, and it has all sorts of different words on there that we need to um, adopt as a community and start using. And these words do change. Words change and verbiage changes, and we progress in how we address um, substance use disorder all the time, and the things that are most appropriate to say. But the word habit, the word abuse, the word opioid replacement, those are words that we don't want to say because they contain a negative connotation. Um, they're ugly words, just like urine drug screen. We don't want to say that. We want to say drug screen analysis. The word urine is just not a real pretty word. There's a lot of words like that we need to change how we say things out in the community, and it will change how people look at this disease. Next. Okay, if you are a treatment center or any type of agency actually that works with people that are working to get into recovery, share your impact reports if you have them. That is so very important to show your community. And so this is something that it's very powerful to show what's going on in your agency and how your treatment works, regardless what type of treatment that you offer. Show that. And I think the most powerful statistic is this one that I highlighted in hot pink. Statistically, each patient is connected to 7 others. And each patient in treatment is closely connected to 7 others. And so that way you can tie that to how many people your treatment is actually affecting. And so this actually shows our Morristown office, and it said we had 157 new patients in Morristown this past year. So if you times 157 times 7, because those 157 patients directly impact 7 others, that's 1,099 lives that were impacted positively because those people were receiving treatment. So I'll say that again. Every person that receives treatment impacts another 7 lives in a positive way. So company-wide, you can see there, my little arrow says we had 17,500 lives that were impacted because of people receiving treatment. So that's a pretty powerful to be able to share something like that. So I encourage you at your office to do that, or your organization, whatever type of thing that you're offering. Sharing impact reports is really great in order to get the word out in your community and reduce stigma. Okay, next. And lastly, offering services to your partners and your community members. One of the things that we do is we offer 3 main things. Every time I go to speak, I'll say, okay, the number one thing I want to do is offer 3 things to you guys. One is a resource. May we offer you and your staff resources for safe prescription drug medication storage. And so I talk about prescription drug lock boxes and how those work. Then the next thing is training and education. May we offer you and your staff an educational training on the signs of prescription drug misuse, and then treatment options. And then lastly, private help. We want to invite you and your staff members to call our toll-free number and get confidential help. And so this is really important when you are at the Rotary Club, or when you're at the Chamber of Commerce, or when you're talking to any type of a group, that you are offering things to your community, that they see that you're not just serving the patients that come to you, but you're also offering things to your community, and that's really important. Next. So I'll close by just sharing my contact information. This is my email and my mobile number. Our website, ReVIDARecovery.com, and we have a toll-free number for all of our locations, which is 844-739-4122. We're also on LinkedIn, Twitter, and Facebook. We have 7 different location pages for Facebook, but I know this will be sent out. Anybody's welcome to ask me questions. And then the last slide is just to thank you all for being here today and for being interested in what treatment is about and what treatment centers do. We really appreciate you, and I hope you found this to be informative.